Well, but right now, let's focus a few minutes on the state of dentistry here in the UK. The BBC has learned that dentists in England have handed back more than £900 million to the government over the past 2 years for unfulfilled NHS care, as they instead prioritise private work. The chair of the British Dental Association, Eddie Crouch, says dentists' current contract leaves them struggling to make money working for the NHS. Speak to Dr. Deepak Aulak, who is a clinical lead at the Tooth Fairy app, a digital dentistry service. All about this. Welcome to the programme.
Hello, yeah, thanks for having me.
No worries. So how has it come to this?
Yeah, I think the issue we're seeing is that dentists are still working in a contract and a system that was built 20 years ago, and it's not built for patient care in 2026. And what we're seeing is years and years of neglect, and unfortunately this is the result in the articles we're seeing today.
What sort of neglect? Can you explain what it's actually like? Because for a lot of people outside the industry, they'll probably just be thinking, it costs me a lot of money to get my teeth checked. It then costs me more to have something fixed, and it'll take me 2, 3, 4 months to get an appointment in the first place.
Yeah, exactly. So dentists are definitely sympathising with that. So the way dentistry works is the NHS allocates a dentist a certain pot of money, and from that money they hire nurses, have a clinic, pay electrical bills, equipment. Everything has to come out of that pot of money itself. And as you're seeing in today's reports, dentists just can't make ends meet from that particular amount of pot. And some of these allocations actually, let's say a particular patient has one filling or one root canal. Sometimes dentists are getting paid very similar if the same patient has multiple issues. And it's occurring now for many patients. And dentists is that they just cannot seem to find a middle ground. And as you say, many dentists are now offering patient and private care. Well, private care actually is funding a lot of the NHS patients within the same clinic. So without private dentistry, a lot of NHS clinics probably would not survive.
But how come that you are then dentists in England have handed back nearly £1 billion to the government over the last 2 years for all this NHS care? If you're saying it costs a lot of money to the dentists themselves to carry out this work, well, if there's this £900 million pot of money, why is that not being used here?
Yeah, there's two types of dentists that are kind of handing money back. So the first type are those who just cannot perform dentistry. So they've got these particular targets, not able to achieve those. That money is essentially being handed back. And it shows you how difficult it is for patients on that, and even dentists on that particular treadmill. And there's a second allocation of dentists who just, unfortunately, have said to the NHS, we just cannot operate. We're not even going to try to do so. This system that was set 20 years ago, it needs a reform. The system needs to be rebuilt, and the contract needs to be rebuilt as well. Doesn't matter how much extra funding you give us, the system and the contract is just completely outdated.
I'm having a look right now. Band 1 in the NHS is, £27.40? I think that's correct. I'm just having a look online right now for basic treatments, x-rays, preventative care. Band 2 is £75.30 for fillings, extractions, gum treatment. And then Band 3 is £326.70 for lab work, crowns, bridges, that sort of thing, dentures. Are you saying that should be more?
It shouldn't be particularly more. So let's say band 2, for example, as you talk about a filling or root canal. So if a patient comes with one root canal and a patient actually has 2 root canals, the dentist actually get the same amount from the NHS, whether that patient needs 2 root canals doing, and it might take double the time as opposed to 1. And then when you start to get into the weeds of the contract, let's say a particular patient needs 4 root canals, but they're not the right tooth. They're all his premolars with all his hidden canals. They still get paid less. It might take even longer than one to do a molar. So without getting incredibly particular about the contract, the way that it's been funded and the way that particular dentists do treatment is pretty much like they're firefighters, less about prevention and more about just doubling down and trying to get people with these decay and fillings and numerous issues fixed as short time as possible.
So do the patients themselves have to pay for the 2 root canals as you're talking about there, or would they pay for 1?
So they pay for 1. The NHS pays the dentist for 1. And the dentist has to fork out of their own pocket to do double that amount, really. So
that's not fair, is it?
It's just one of the issues that the dentists are saying is that that contract needs reforming. So and that's the reason why dentists are struggling.
What would you... Struggling? I mean, we've just had a text about that come in saying, poor dentist, how much is the average take-home of a dentist? I mean, there is this reputation that dentists are doing all right.
Yeah, of course. And look, we sympathise with patients. They're probably looking at dentists and saying we're struggling in our day-to-day to pay particular bills, and you've got this profession that's moaning about keeping the lights on. It's all about future-proof. We want to make sure dentists are future-proof. They still exist in 10 years, 15 years. We don't want to be the American model where it's completely private and completely unachievable for many patients. And I think that's where dentists want to make a noise now. If we don't do it now, there is going to be a particular issue for many patients that, like some regions, there is absolutely going to be no NHS dentistry.
You've been a dentist for about a decade now, is that fair?
Yep, guilty.
How have you seen it change in that time? And proportionally, how much of your work and others that you know, other dentists anecdotally, how much of it is proportionally now private to NHS in comparison to 10 years ago?
Yeah, more and more of us are moving towards private because, as we say, the private is what keeps the lights on and actually funds some of the NHS dentistry. And private, remember, doesn't have to be completely extortionate. Private dentistry, some of the fees are very similar. They've got similar plans to NHS, but actually what we're doing is trying to fix the qualms of the NHS and those numerous treatments. And then we're using hygienists and therapists and a lot of other alternative practitioners to help our patients as well. And then obviously dentistry, if you look at the times, I think it's 2 to 3 times in the last 5 years, the NHS has increased fees. Actually, that's less funding going in, but the patient's paying more. And dentists are saying it shouldn't be the patients paying more, it should be the NHS helping patients. So we're making it harder and harder for patients to access dental care.
I'm going to come on to what reforms you'd like now, if you don't mind. If you can just give us, you've mentioned it a number of times, quite specifically, if there was a new contract, if you could change that tomorrow, give me 2 things that you would put in straight away.
Yeah, definitely rewarding dentists to keep people healthier. Right now, if we stop fillings and we stop decay and extractions, the NHS are not really bothered. We want to make people healthier. We want to make sure they don't have crowns and fillings and those particular aspects. And then the second aspect is digitalization. Unlike GPs and physiotherapy and mental health, dentistry is really lagging behind in the NHS, exchange of records and notes, a lot of the patients overspilling into secondary care. So we need the NHS contract to really be digitalized, dentistry to really come into 2026. That's going to help a lot of patients accessing dental care.
Okay, we'll leave it there. Thank you so much for your time and explaining some of the situations there. That's Dr. Deepak Aulak, a clinical lead at the Tooth Fairy app, which is a digital dentistry service. It's 6:44.